Okay, think about this for a second. What if one of the most powerful new tools in the fight against cancer wasn't some brand new billion-dollar drug, but something you might already have in your medicine cabinet? Let's get right into it.
I know, it sounds a little out there, right? Could a simple allergy pill, the kind you take for hay fever, actually have a role to play in treating cancer? Well, you might be surprised to hear this, but a huge and growing body of research, looking at thousands and thousands of patient records, is pointing to one answer, and that answer is a big yes. We're talking about real data linking some of these everyday pills to dramatically better survival rates.
So let's talk about this unlikely partnership. What's the actual evidence here? And we're not just talking about one or two niche studies. This research pulls from data covering at least 15 different types of cancer. So yeah, this seems to be a pretty widespread effect.
Okay, just look at these numbers for a second. They're pretty staggering. For melanoma, we're seeing a risk reduction of over 50% with desloratadine. Advanced lung cancer, a 30 to 40% improvement. Breast cancer, over 30%. Ovarian cancer, almost 40%. I mean, these aren't just tiny little statistical bumps. These are huge, substantial improvements. And this isn't just us connecting the dots. The scientists behind this research are saying it loud and clear. They're calling it a compelling case and are pushing for full-blown clinical trials. They see a real chance here to make a big difference, especially for folks who don't have a lot of other treatment options.
So the big question is, how? How on earth does a simple allergy pill do all of this? Well, it's all about how they give a massive boost to the cancer treatments we already have.
And here's where it gets really exciting, especially with immunotherapy. That's the cutting-edge treatment that teaches your own immune system to hunt down cancer cells. Well, adding an antihistamine can be a total game changer. For cancers like melanoma and lung cancer, we're talking about boosting how well it works by 2, even 3 times. That's incredible. And it's not just immunotherapy either. Get this. In one study on advanced liver cancer, when they added the antihistamine ciproheptadine into the standard treatment plan, it more than doubled survival times for patients. Let that sink in for a moment. Doubled. Okay, so this all leads to the obvious question. What is actually going on inside the body? How does this even work? Let's pop the hood and look at the science. It's actually pretty cool. You see, tumors are sneaky. They flood the area around them with histamine, which basically acts like a cloaking device. It tells your immune system soldiers, your T cells, nothing to see here, move along. So the cancer is just hiding in plain sight. But what H1 antihistamines do is they come in and jam that signal. They basically rip off the invisibility cloak, allowing your T cells to finally see the enemy, wake up, and go on the attack. It just supercharges the whole process.
Okay, this next part is super important. You can't just run out to the pharmacy and grab any old allergy pill off the shelf. It turns out the specific drug you use really matters.
So, the two names that keep popping up in all this promising research are desloratadine and loratadine. But it gets even more specific. The data seems to suggest that desloratadine works better for earlier, more localized cancers. On the other hand, loratadine appears to have the edge when the cancer is more advanced or has started to spread.
All right, let's pause here, because this is probably the most important thing we're going to cover. As exciting as all this potential is, there are some huge risks and critical details that you absolutely have to know about.
First up, timing is everything. All of these amazing benefits we're talking about, they are consistently linked to taking the medication after a diagnosis while undergoing active cancer therapy. Taking these pills before diagnosis to try and prevent cancer, the data just isn't there. In fact, some studies even hint that long-term use beforehand might slightly raise the risk for certain cancers. So let's be crystal clear. This is about helping a treatment, not preventing the disease.
And just as important as when you take it is what you take. See, there are different kinds of antihistamines. All this good news is about H1 antihistamines, your typical allergy pills. But there's a whole other group called H2 antihistamines, which people often use for things like heartburn or acid reflux. And here's the kicker. Some research suggests these H2 drugs might actually make immunotherapy less effective. So you can see why getting the exact details right is absolutely vital.
So, when you put all these pieces together, what are we looking at? Well, this could be an incredible new frontier in cancer care. The idea that we can use these super common, inexpensive, and safe drugs to make our main cancer treatments work even better, that's a pretty amazing thought. Okay, let's boil it all down. What are the big takeaways? 1. Some specific H1 antihistamines seem to be strongly linked to better cancer survival. 2, they work by giving a huge boost to treatments like immunotherapy. 3, the exact drug and the timing, taking it after diagnosis, are everything. And that brings us to the biggest takeaway of all, and please listen carefully. This is not a do-it-yourself cancer treatment. Do not try this on your own. The whole point of this is to give you information to have a smarter conversation with your doctor. You must talk to your oncology team first.
This whole idea of repurposing old drugs for new fights is just so fascinating. It really proves that sometimes the most powerful tools can be found in the most unexpected places. And it really makes you wonder, doesn't it? What other life-saving secrets are just sitting there, hiding in plain sight inside our own medicine cabinets?